Nearly 19,500 Indians turned 60 today. Tomorrow, another 19,000 do the same, steadily shifting the country's demographic center away from its famous youth dividend. Look at this demographic pyramid showing our population structure. By 2050, the base narrows and the top expands until 1 in 4 Indians is a senior citizen. This creates the silver economy, an ecosystem of products, services, housing, and government policies built specifically for older adults. These daily scenes in public parks are the quiet precursors to a systemic shift in urban design, healthcare funding, and the allocation of national wealth. For anyone tracking long-term policy or market trends, this demographic shift represents a massive reallocation of capital. The Indian senior care industry currently sits at a valuation between $10 and $15 billion. As this chart shows, that valuation is projected to reach $50 billion over the next 10 years. That capital is flowing into 3 specific sectors: organized retirement communities, assisted living facilities, and specialized health tech. Major hospital chains and real estate developers are already rotating their investments towards senior living projects to capture this growth. Eldercare now operates as a central driver of long-term corporate equity growth. The state is attempting to match the private sector's speed by rewriting federal welfare policy. The Ayushman Bharat scheme now provides 5 lakh rupees of free health coverage to every citizen age 70 and above. By removing the income barrier entirely, the government is moving toward a model of universal healthcare for this demographic. Through the SAGE initiative, the Ministry of Social Justice is acting as a venture capitalist for the aging sector. The program provides up to 1 crore rupees in direct equity funding to startups innovating in eldercare. The government also launched the Sacred Portal, a platform designed to connect seniors with re-employment opportunities to keep them economically active. Between $50 billion in private market projections and aggressive state-backed funding, India appears prepared on paper. But those projections rest on a foundation with deep structural cracks. India produces fewer than 80 geriatricians, doctors specializing in elder care, every year. A population of hundreds of millions cannot be supported by fewer than 100 new specialists annually. The human capital required for intensive elder care is missing. While corporate money targets metro cities, 70% of India's seniors live in rural areas. Most of these individuals lack pensions and rely on traditional family structures that are dissolving as the younger generation moves to cities. Despite the grand policy announcements, less than 0.1% of state health budgets are specifically dedicated to elderly care. A $50 billion corporate market cannot function if the foundational medical and rural infrastructure beneath it is crumbling. The silver economy is an inevitable reality. Bridging the gap between policy and infrastructure is the only way to support 300 million seniors. Do you believe the current healthcare infrastructure is genuinely ready for this demographic shift? Let me know in the comments. Subscribe for more deep dives into the intersection of economics and public policy. Thanks for watching.